Magnesium fuels over 300 reactions in your body, yet up to 80% of people are not getting enough. Here is what worries me most. If you use magnesium the wrong way, it can cause harm. After reviewing many medical studies, I keep seeing the same preventable mistakes. People take magnesium when they should not, or they combine it with medications that create dangerous interactions. These mistakes can lead to kidney strain, breathing trouble, and even heart rhythm problems. In this video, you will get a complete magnesium guide for adults over 60. We will cover the real benefits, the real risks, and the safest way to use it. You will learn who should consider magnesium and who should avoid it, how much to take, the most gentle forms for sleep and cramps such as magnesium glycinate and magnesium citrate, the best timing for absorption, and warning signs to watch for such as diarrhea, dizziness, low blood pressure, or unusual fatigue. I will also point out medication families that require extra caution, including certain blood pressure medicines, some antibiotics, and muscle relaxants. By the end, you will know how to supplement wisely so you protect your heart, brain, bones, energy, and mobility. Ready to begin? Let us begin with the first crucial question. Do you truly need a magnesium supplement? Many people are taking magnesium without knowing whether they actually need it. Here are the clear signs that your body may be asking for more magnesium. The first major sign is muscle problems. You are lying in bed and just about to fall asleep when your calf suddenly locks into a painful cramp, or your eyelid keeps twitching no matter what you try. These can be signals that your body is asking for magnesium. Magnesium works like a natural calming agent for your nerves. When you do not have enough, your nerves become overexcited. Think of them as live electric wires that will not switch off. This can lead to muscle cramps, twitching, numbness, and a tingling feeling in your hands and feet. It is not only about cramping. Have you noticed that your legs feel weak when you walk, or that you cannot find the strength you used to have? Magnesium is essential for energy production inside muscle cells. Without adequate magnesium, your muscles cannot access the energy they need to work properly. What if stress is quietly draining your magnesium and making you feel worse each day? The second major sign is stress and emotional problems. Stress does not only affect your mind, it also depletes your body's magnesium stores. This creates a vicious cycle that many people do not even notice. When you feel stressed, your body shifts into fight or flight mode. The sympathetic nervous system speeds up, and your body starts demanding more magnesium to cope. At the same time, stress hormones like cortisol and adrenaline make your kidneys lose magnesium in the urine. So stress uses up your magnesium, and low magnesium makes you feel even more stressed. It is like sinking in quicksand. The more you struggle, the deeper you go. If you feel anxious, irritable, or you lie awake at night with a racing mind, magnesium may be the missing piece in your routine. Are you over 60 and feeling more tired or weaker than before? The reason might be simple. Your body may not be absorbing enough magnesium, even if you think you eat well. The third group that needs magnesium is older adults. As we age, digestion becomes less efficient. The stomach produces less acid, so magnesium in food does not dissolve properly. The intestines also absorb fewer nutrients than they used to. Even when magnesium dissolves, less of it reaches the bloodstream. Diet patterns change too. Many older adults eat fewer magnesium-rich foods, such as leafy greens, whole grains, and nuts. These foods can be harder to chew or digest, and appetite often decreases with age. This creates a double hit. Lower absorption and lower intake together make magnesium deficiency very common after 60. Certain digestive conditions raise the risk even more. Acid reflux, irritable bowel syndrome, and inflammatory bowel disease can interfere with nutrient absorption. If you live with any of these, your magnesium needs may be higher and your levels may run low. Are your everyday medicines quietly draining your magnesium without you noticing? The fourth group includes people who take certain common medications. If you are on diuretics, often called water pills for high blood pressure or heart problems, you need to pay close attention to magnesium. These medicines make you urinate more, and they do not only remove extra water, they also flush out magnesium, which can leave you deficient. The same risk appears with acid-blocking medicines known as proton pump inhibitors. If you take drugs such as omeprazole for heartburn or ulcers, you reduce the stomach acid needed to absorb magnesium properly. Over time, that reduction can lead to deficiency, even when you eat magnesium-rich foods. If this sounds like you, talk with your clinician about checking your magnesium status and about safer timing or forms such as magnesium glycinate or magnesium citrate. Do you have diabetes and feel more tired, crampy, or restless than usual? Your magnesium balance may be the missing link. The fifth group that often needs extra magnesium is people with diabetes. Here is what happens. When your blood sugar is high, your kidneys work overtime to clear the extra glucose in your urine. Magnesium gets swept out along with the sugar, which can lower your levels. Insulin adds another twist. When you take insulin, it does not only move sugar into your cells. It can also pull magnesium into cells, which may temporarily lower magnesium in the blood. Since magnesium is crucial for insulin to work properly, low magnesium can make blood sugar control harder, creating another vicious cycle. There is an important safety note. If you have diabetic kidney disease, you must be extra careful. Damaged kidneys do not remove excess magnesium efficiently. In that case, supplementing could be risky. Always check with your doctor first. Do you drink alcohol, sweat a lot, or have high blood pressure? Your body may be losing magnesium faster than you can replace it. If you drink alcohol regularly, you likely need more magnesium. Alcohol interferes with absorption in the intestines and increases loss through urination. Even moderate drinking can slowly drain your magnesium stores over time. People who exercise intensively or work in hot environments also lose significant magnesium through sweat. If you are a construction worker, an athlete, or someone who sweats heavily most days, you are literally losing magnesium through your skin. If you have high blood pressure, magnesium may help. It acts like a natural muscle relaxer for blood vessels. When arteries and veins relax, blood flows more easily, and overall pressure on your cardiovascular system can come down. There is also a hidden reason many people fall short. Modern farming has reduced magnesium content in the soil. So many foods contain less magnesium than they did 50 years ago. If your diet does not regularly include dark leafy greens, whole grains, nuts, seeds, and beans, you are probably not getting enough from food alone. For most adults, taking 100 to 200 milligrams of magnesium daily is generally safe and beneficial. If you have symptoms of deficiency, you might need more, but do not exceed 350 milligrams per day from supplements unless you are working with a healthcare provider. Which magnesium forms actually help, and which are just wasting your time? Not all magnesium supplements are created equal. Magnesium glycinate and magnesium malate are highly absorbable forms that are gentle on the stomach and easy to tolerate. If comfort and consistent absorption matter to you, these are smart choices. Avoid magnesium oxide unless you are specifically trying to relieve constipation. It is poorly absorbed and behaves more like a laxative than a true nutritional supplement. Who should never take a magnesium supplement? For some people, even a small dose can be dangerous. The first group that must avoid magnesium without doctor supervision is anyone with kidney problems. Your kidneys clear excess magnesium from the body. When they do not work well, magnesium can build up in the bloodstream and cause hypermagnesemia. Early warning signs include nausea, vomiting, and diarrhea. As levels rise, symptoms can progress to muscle weakness, low blood pressure, trouble breathing, and an irregular heartbeat. In severe cases, magnesium toxicity can stop the heart. A quick real-world example. Helen is 72 and has mild chronic kidney disease. She took magnesium for constipation, not realizing her kidneys could not clear it efficiently. After 5 days, she felt nauseated, unusually tired, and thought she had the flu. Her daughter brought her to the clinic. Blood tests showed dangerously high magnesium. She needed hospital care to remove the excess. If you have any degree of kidney disease or kidney failure, do not take magnesium supplements unless your clinician is closely monitoring you. Do you already run low on blood pressure? Magnesium could push it even lower. The second group that should avoid magnesium is people with hypotension. Magnesium relaxes blood vessels and naturally lowers blood pressure. If your pressure is already low, it can drop to a dangerous level. That can trigger dizziness, fainting, or falls, which is a serious risk for older adults. Consider Albert, a 69-year-old retiree whose blood pressure usually ran on the low side. He began taking magnesium for muscle cramps. On the third day, he stood up from his morning coffee, and the room started spinning. He caught the counter to avoid a fall. When his wife checked, his blood pressure was 85/55, which is dangerously low. They called his doctor, mentioned the new supplement, and were told to stop it. Within 2 days, his readings returned to normal, and the dizzy spells disappeared. If you live with low blood pressure, do not start magnesium without speaking to your clinician first, and be alert for lightheadedness, blurred vision, or near fainting. Do you have a slow heartbeat or a known rhythm problem? Magnesium could make it worse. The third group includes people with a slow heart rate or heart rhythm disorders. If you live with bradycardia or a condition called heart block, magnesium supplements may slow the electrical signals in your heart even further. This can raise the risk of severe arrhythmias and, in extreme cases, cardiac arrest. Consider John, a 75-year-old man with a naturally slow resting heart rate of about 55 beats per minute. His doctor was monitoring it, and no treatment was required. Frank started magnesium for better sleep after reading about its benefits. Within a week, he felt unusually weak during his daily walks. At his checkup, his heart rate had fallen to 42 beats per minute. The magnesium was making an already slow heart even slower. His doctor stopped the supplement, and over the next several days, Frank's heart rate returned to his usual baseline. Are your medications and magnesium quietly working against each other without you knowing? The fourth group includes people who take certain medications. Magnesium can interact strongly with several drug classes. Antibiotics such as tetracyclines and fluoroquinolones can bind to magnesium in the stomach. This blocks absorption and lowers the antibiotic's effectiveness. Always separate doses by at least 2 hours. Consider Amy. She was prescribed an antibiotic for a urinary tract infection. She had been taking magnesium with breakfast for months. She did not realize that the magnesium was preventing proper absorption of her antibiotic. After finishing the entire course, her infection was not clearing. Her pharmacist reviewed her supplements and found the issue. Once she spaced the doses correctly, the treatment worked. Muscle relaxants are another concern. Magnesium has its own relaxing effect on muscle and blood vessels. Combining the two can push blood pressure and heart rate too low. This raises the risk of dizziness, fainting, and weakness. Cardiac glycosides used for heart failure also require caution. Medicines like digoxin help the heart pump and control rhythm. Taking magnesium at the same time can change how the drug is absorbed and handled in the body. This can blunt the effect or make the action unpredictable, which may reduce safety and increase rhythm risk. Take Alex, an 81-year-old on digoxin with stable levels for years. She added magnesium for leg cramps. At her next checks, her digoxin levels were swinging, some days too low, other days too high. After weeks of adjustments, her cardiologist realized magnesium was the culprit. Once they coordinated the timing of both, her heart medicine became stable again. Most magnesium mistakes are preventable. Follow these simple rules to stay safe and actually feel the benefits. First, be careful with high-dose vitamin D. Your body needs magnesium for vitamin D to work, but taking more than 4,000 IU per day can drain your magnesium stores. If you use high-dose vitamin D, make sure your magnesium intake is adequate. Do not assume that more is better. Second, do not rely on blood tests alone. Only about 1% of total body magnesium is in the blood. The rest lives in bones, muscles, and cells. Blood levels can look normal while tissues are low. Watch symptoms such as muscle twitching, weakness, numbness, and tingling in hands and feet, heart palpitations, anxiety, poor sleep, and fatigue. Third, balance calcium and magnesium. Taking calcium without magnesium can push calcium into the wrong places. That may raise the risk of kidney stones and stiff arteries. A simple guide is 2 parts calcium to 1 part magnesium. Fourth, limit caffeine and alcohol. Both increase magnesium loss through the kidneys. If you drink coffee daily or enjoy alcohol, be consistent with your magnesium plan to offset these losses. Fifth, do not take large doses on an empty stomach. That invites diarrhea, cramps, and nausea. Split your dose and take it with meals. This reduces side effects and improves absorption. Here is the proper way to start. Begin with 100 milligrams daily with dinner. See how your body responds. If you feel well after 1 week, increase to 200 milligrams daily, split between morning and evening. Choose magnesium glycinate or magnesium malate for better absorption and fewer stomach issues. Take each dose with food that includes some healthy fats. Avoid pairing magnesium with very high fiber meals or fiber drinks because fiber can block absorption. Magnesium only works when the rest of your routine works with it. The supplement is not the whole plan. Your daily habits are. Remember that magnesium supplementation is most effective when it is paired with a healthy lifestyle. No supplement can overcome a diet high in processed foods, excess sugar, and ongoing stress. Think of magnesium as one important piece of your health puzzle, not a magic fix. Now it is your turn. Have you noticed any signs of magnesium deficiency we discussed? Do you have questions about whether magnesium is right for your situation? Share your questions and experiences in the comments below. Thank you for watching. If this video helped you understand magnesium and avoid serious mistakes, please tap like, share it with friends and family, and subscribe to Senior Strength 60 Plus. We are committed to giving you science-based health information that is practical, safe, and easy to use.